My name is Juanisha Byrd. I'm the Evidence-Based Program Specialist with Cobb County Senior Services. I'll be sharing research on measuring the prevalence of loneliness among older adults during the COVID-19 pandemic. Our main findings were that 47% of respondents selected responses indicating lonely, and 53% of respondents selected responses indicating not lonely. In the table, we grouped each response into two categories. Scores ranging from 3 to 5 are considered not lonely, and scores ranging from 6 to 9 are considered lonely. The challenges of COVID-19 have impacted older adults in many ways. Senior centers offer older adults daily opportunity for socialization, recreation, and nutrition. As a result of the global recommendation to limit physical contact as much as possible, these centers were closed on March 16th in response to the COVID-19 pandemic due to the vulnerable at-risk population served. Mortality data from Oxford COVID-19 Evidence Service indicates a 3.6% risk of mortality for people in their 60s, a 14.8% risk of mortality for people in their 70s and over 80s if they are infected with COVID-19. The global recommendation for older adults includes prolonged periods of social isolation and staying home to avoid contact with other people. The collapse in social contact is negatively affecting the populations most vulnerable to loneliness and isolation. According to the Health Resource and Services Administration, loneliness and social isolation can be as damaging to health as smoking 15 cigarettes per day. Seniors who report feeling lonely have a 45% increased risk of mortality. A survey was mailed to 313 seniors aged 60 and older who attended senior centers prior to the pandemic to determine the prevalence of loneliness among clients. The survey response rate was 33%, and the survey included the University of California, Los Angeles Loneliness Scale. The UCLA 3-item loneliness scale uses 3 response categories. The response hardly ever is coded as a 1, the response some of the time is coded as a 2, and the response often is coded as a 3. The 3 questions are: how often do you feel that you lack companionship? How often do you feel left out? And how often do you feel isolated from others? Researchers in the past have grouped the responses into 2 categories: not lonely for scores ranging from 3 to 5, and lonely for scores ranging to 6 to 9. The graph here shows responses to each question. The response hardly ever is shown in yellow, the response some of the time is shown in orange, and the response often is shown in red. To the first question, how often do you feel isolated from others? 43% reported hardly ever, 38% reported some of the time, and 18% reported often. To the second question, how often do you feel left out? 41% reported hardly ever, 37% reported some of the time, and 21% reported often. To the final question, how often do you feel you lack companionship? 30% reported hardly ever, and 49% reported some of the time, and 20% reported often. In our study, we found that 47% of seniors reported feelings of loneliness. Cobb County Senior Services can use this research to develop virtual activities and implement periodic evaluations to determine their effectiveness. Future research should be conducted to determine what interventions and programs work best for reducing loneliness and isolation. Senior centers can use this analysis to expand assistive technology equipment and programs designed to increase social integration. Senior centers must also assess loneliness among seniors on a regular basis in the future. And the survey results indicate the need for loneliness and social isolation interventions for older adults. My contact information is listed here. Thank you.